are you from? I'm from Singapore. How about you? Which city and country are you from? Can you type in the chat group so that we know where are you from? Because I understand today participants actually coming from different regions. From Singapore, from Philippines, yes, Burdette, yes, from Singapore.
Where do I type?
Yes.
Where's Dr. Lucero presentation now?
So welcome back to today's second lecture presented by CP Philippines, featuring Dr. Florencio Lucero. Okay. The title for today is Protecting from yourself from the invisible enemy. Okay, because we know COVID-19 is still pandemic is still around the region, and some of the countries have seen a second wave of this infection. So what can we do during this period to protect ourselves? We are very thankful and honored to have a special speaker with us today, and I respect him a lot. He is a plastic surgeon in training. He has more than 40 years of experience in plastic surgery, and he has many titles. Okay, his profile is very long, but I'd just like to highlight a few. Okay, currently at his age, at 76, he's still practicing, his plastic surgery and providing services to his patient. And he runs his own private clinic at FQL Wellness Center at Salute Medical Center in the Philippines, Manila. And not only that, Dr. Lucero is also the Secretary General of OSAP. OSAP is the Oriental Society for Aesthetic Plastic Surgery, where there's 10 members country of all the plastic surgeons in all these countries in the Asia region, ASEAN region. And I understand that actually there is an OSAP meeting in Penang in June, but due to the COVID-19, it was postponed. And now they actually do run some conference on Zoom as well. Dr. Lucero is also the former chief at the as the plastic surgery department of the Philippine General Hospital, where he also groom and nurture many of the young plastic surgeons. And Dr. Lucero believes in lifelong learning, so he always keeps himself braced and about what is happening in the medical field, the latest development, and he travel and attend many medical conferences as well. He himself is also featured, often invited as a keynote speaker to share his wealth of knowledge and experience, and also his wisdom to many of the plastic surgeons in the region. Okay, so today he will share with us, okay, how do you protect yourself from this invisible enemy? Okay, so are you all ready to hear from Dr. Lucero? Okay, so before you invite him on board, we request all of us to mute our audio so that we can pay attention to Dr. Lucero. Okay, so let's welcome Dr. Lucero.
Yeah.
Dr. Lucero, over to you. Yeah, thank you.
Good morning from Manila. I'm glad to see many friends from Singapore, and I see some familiar names from the Philippines. And let me see. Okay, let me show you my first slide. That's the title of this morning, and hopefully this is going to help everyone during this pandemic, as the company has always helped many people because of the product that they proudly promote from Singapore. So how do we protect ourselves from the invisible enemy? So it's difficult to fight an invisible enemy. It's like fighting a ghost. How do you fight a ghost when you cannot see? I know how to fight a ghost with prayers. That's the only way, with prayers. This is the latest as of yesterday, the worldwide number of coronavirus cases. reaching more than 13 million or close to 14 million. And the deaths so far had been 500,000. Recovery is not very impressive. In the Philippines, they are projecting by the end of this month, we're going to reach a figure of 8,000 cases. So I hope we don't reach that in the Philippines. How's my audio? Are you okay?
Yes, good, very good.
Yeah.
Okay, very good.
Yeah.
And so this is the kind of invisible enemy that we are fighting against. It's easier to fight the one on your left. These are bacteria, examples of bacteria, because the antibiotics that are available, most of them are able to work or control bacterial infection, except for those that are resistant to the existing antibiotics. The one on your right is like an example or representation of how the virus, the coronavirus, appears under the microscope. And this is something that the WHO has given a lot of pronouncements that are different every so often, every month, every 2 months. There's a different version. And the latest version so far, as of yesterday, if I'm not mistaken, is they now believe it is airborne. They used to say that it lands on the surface of anything, solid things, and it remains there for several hours or maybe even days. But now they're saying it's really airborne. That is why the recommendation has been, as always, for several months, is to use the mask. This COVID can affect every part of our body. And in most severe cases, one of the findings was is a coagulation of the blood in the different parts of the body. That's why it leads to the demise of these patients who don't recover from the COVID-19. And that's a sad thing to note and to know. So we really have to take care of ourselves, to take every precaution and every action that needs to protect the body from entry into our system. Now, this is the latest from WHO that this is airborne. Now you can say it's both the droplets and the airborne virus. And so what we need to do to protect ourselves is really the long-standing recommendation from the very beginning of this lockdown, which is the mask. You have to be careful in the choice of your mask. There's some period of discomfort when you're using the mask. I experience that when I'm using the mask. So I use a respirator type when I'm doing my operation in the operating room. When I use any kind of mask like this, especially this one, I'm showing you with my pointer, and this one is a little more comfortable because there's a valve. But now they say this is not a good one, especially if the person is already supposedly infected. And the virus, when the person breathes out, the virus can come out through this valve. So it's more comfortable to use, but it's not safe for someone you are dealing with or talking with. This one is difficult to breathe through. So I have a hard time when I'm doing an operation. I don't have a picture here of what I use as a respirator mask that has a side respirator like a sponge encased in a container on both sides, and the breathing is so much more fluid and more convenient. So take note of this. This came from a reminder from a hospital that they will not allow people or patients coming into the hospital with this kind of a mask. They will be stopped at the door. This is maybe the latest about the vaccine, the development of the vaccine. When they started talking about the vaccine, they said it's going to take more than 2 years. It's going to take a longer time, maybe because of the testing, the safety. But they said lately that it's almost ready. They always make the people very hopeful that it will come out sometime late this year. The two prominent companies that are saying that are Moderna, this one here, and the one coming from Oxford University. The Oxford University is, I think, associated with a company, pharmaceutical, AstraZeneca. And one of my friends who owns a pharmaceutical here in Manila yesterday said that the first one that will get it would be Astra from University of Oxford, but then it will not be easily distributed here in Asia. So their priority will always be Europe and maybe the United States. So what do we need to do? We need to have a good defense or maybe a best defense. And to me, our best defense is our healthy immune system. Many of the clinicians, either in the mainstream or in the integrative or functional medicine community, will always tell their patients that you have to improve your immune system because that is your best defense. And how do we do that? So we'll talk about that. The immune system is multifaceted and complex. It's not easy to understand right away. It's easier to say, I want to improve my immune system. But what is it? What does it entail to improve your immune system? What does it make, or what do you have to do? What do you have to take? What do you have to institute inside your system in order to make your immune system strong and healthy? So this is multifaceted. You can look at it as something like going through the airport. There is the custom, there is the police, but in some countries they're all the same in the airport. Custom police. So the custom will be the cells also in your body, that the first line of defense will be the macrophages, because they control the bacteria entering the body. They try to prevent them, but then once they are able to get in, you have to rely on the police, because this will have to rely on cells that can eliminate the abnormal cells or the invading cells. So these are the cells that I found to be working or playing its role as a custom police for our body. These are the different cells in our blood and in our cells, different tissues. So primarily, these are the cells that initially prevent the entry of invading organisms or invading elements that might decrease or prevent the body from functioning normally to be healthy. So just take note that these are cells in your body, and most of them are available in your circulating blood. So when we get a wound, let's say, an example is a wound on the skin or any place of our body, these cells initially are called to the site to help that part of the body that was injured to be protected. Again, there are other things that can affect our immune system. It can lower the immunity like fatigue, mental pressure, irregular sleeping habits. These are the lifestyle that can affect the different hormones in our body and negatively affect the immune system. The insufficiency of nutrition or nutrients and even some microelements or like minerals can also immune system. When you look at the immune system, you see the role of the different food that we eat that are digested, the vitamins, the minerals get into play in the process that happens inside the cell. So these are things that we should keep in mind and be able to supplement ourselves, not only depending on the food that we eat every day. What kind of damages will result if the immunity is low? Of course, first, the invasion of all kinds of germs, more susceptible to be infected by all kinds of bacteria and viruses if our immune system is low. That's why when this COVID-19 started and they noticed that the the risk is higher in older people, in people with chronic illnesses. They are more compromised. They are more susceptible to the invasion of the germs or of the virus. And so we have to keep in mind that during normal times when COVID-19 wasn't still here, physicians in the mainstream, in functional medicine, in integrative medicine field, they talk about chronic illness. They talk about improving your immunity so that you can combat the chronic illness. And chronic illness slowly develops at any age. You will start seeing in some more susceptible individuals, chronic illness starts even as early as in their 20s, in their 30s. But oftentimes we see them when life begins at 40, that's when we start noticing we're getting chronic illness. These are medical conditions that make us worry. What are these? Diabetes mellitus, hypertension, so on and so forth, weakness of the heart, weakness of the lungs, because of our lifestyle over the years. How do we support our immune system? This is just an example of things that we have to keep in mind to improve our eating habits, our hydration, what kind of food do we eat, what kind of other ingredients in our food that might help improve it. Why do we need probiotics? Why do we need to improve the bacteria in our intestines? Why do we have to have adequate sleep? Why do we notice people who cannot sleep well have high blood pressure or hypertension? So these are the things. And we notice during these modern times that stress management is very important in all, and even staying active with exercise, very important in supporting the immune system. And every tissue of the human body needs support. We have to realize that. All of that, you know the different parts of the body, all of these tissues in the body need support. And if one of them becomes defective, then we start feeling all the symptoms related to that. Some people give more importance to kind of food like protein because they think this are this will build up the body. This will be important ingredients of hormones and enzymes, and because if you don't have enough protein in the body, like we call it the albumin level of our blood, then we are more prone to edema or swelling, and that's well known for a very long time already. And also, it it has a role in formation of antibody because the amino acid there gets into the play of developing antibodies or formation of antibodies to fight the pathogen trying to invade the body, trying to enter. Don't pay attention to this. I'm just not going to give you a importance to that slide. And these are the chronic illnesses that I'm talking about. Myriads of chronic illnesses. And most of us, physicians and even patients, rely on medications in order to help conditions of patients with chronic illnesses, chronic diseases. Look at all of this. This list of conditions or illness will always have a medication or a drug that can be used to treat them. And I particularly like to talk about lowering the cholesterol. And so this is a big money-making drug, the pharmaceutical, lower the cholesterol. Cells are not functioning properly. You have to mute that participant. When cells are not functioning properly, and mind you, how many cells are there in the body? Almost 100 trillion cells in the whole body. And one of them can be represented like so, with different parts, with different parts like the cell wall, the nucleus, and the different organelles inside. If they are not functioning properly, it results in disease or illness. And then why do they get sick? Why do the cells get sick? Well, because of the toxicity that enters the body. Toxicity including pathogens, bacteria, viruses. And they also get sick because of deficiency of nutrients. And before all of this developed, before all this knowledge about immune system came about, we always talk about only of free radicals. Free radicals can also be called reactive oxygen species. And they are not good for the cells because free radicals are elements or molecules that lack one electron. So they're like uncontrollable little kid that keeps on running around the house. And so you have to give them a piece of candy so that they will keep quiet. So the same thing with the free radicals. You have to give them so that they will keep quiet and they will not damage the cell. But unfortunately, where do they get the electron? They get it from the normal cells. And so when the normal cells lack the electron, then it's not functioning very well. That's as simple as an explanation I can give. And all of this result in inflammation, and the inflammation result in the different conditions that are manifested by our body day in and day out. Again, the cells are attacked by the free radicals or the ROS or reactive oxygen species. First, it has to enter the cell membrane. It breaks the cell membrane to get inside, and all the parts inside the cell can become affected, and the function becomes depressed, inhibited, or sometimes completely damaged. is the most important part inside. I used to think when I was a student, the most important parts of the cell are the cell wall and the nucleus. But the defense mechanism of these two parts are very good. Once the pathogen or the free radicals were able to enter the cell, what is more important to prevent or to keep healthy is or are the mitochondria. It's a very important organelle inside that is called also the power plants because it produces the ATP that gives the energy. Lack of ATP gives you a weakness, a lack of pep every day. So when you have that, most likely you don't have a healthy mitochondria. So reduction, the findings, these are findings from studies that reduction of free radicals can activate the genes of the mitochondria and it can replicate, meaning it can double in number. The more mitochondria we have, the better energy we have also. And one of the findings in a study for scientists or doctors who believe in coconut oil and even the refined product of coconut oil called MCT also helps in reducing the activity of the free radicals and help the genes of the mitochondria to replicate, producing more mitochondria and making the person healthier. So most likely, this is the most important part. When I started talking for the company in Singapore, I first introduced them to the word mitochondria because I think that is the most important way to improve the health of a person. And if you are into healthy foods and supplements, you will ensure the efficiency of the mitochondria. So how do I take care or how do I take charge of my health? These are I'm showing this because these are the books I looked into. I read them. I finished most of them. I have not finished a few of them. And the latest is this one, the Walls Protocol. All of this will give you tips on how to take care or how to take charge of your health because they will give you tips. These are all written by doctors. They are all MDs. They're not even DOs. They're all MDs. And written by doctors who were thinking or are thinking out of the box. Just like what we are doing now. We are thinking out of the box. That's why we are listening to this talk. So these are just to give you a bird's eye view of the materials that I have gone through in order to help me take charge of my health. These are the different tips that I had instituted on myself 3 years ago, or a little over 3 years ago, in order to improve my health. And mind you, I want to tell you that I have been on multivitamins since 18 years old. I don't know how many of us had been like that, but I don't know why I thought I should take multivitamins when I was only 18 years old. That was when I was in college. And I label myself as a sucker for supplements because of that. Since 1962, I had been on multivitamins. More and more were added since 1980, and that is 1980 was when I returned to the Philippines from the United States, and I started taking more and more multivitamins and supplements. And the latest addition to that list is Celergen. But you will notice that I did not put it at the center. The center of all of this was supplement is vitamin C. So what we need is prevention of illness, and that should start with the cell. We need to protect healthy We need to repair damaged cells. We need to regenerate new healthy cells. And I talked about all of this in the previous slides. Now I'm going to the latest addition to my list of supplements, which is Celergen. Celergen is a product with synergistically blended ingredients. It is made up of bio-DNA cellular marine complex. That is the main ingredient. And 3 kinds of peptides, peptide E collagen and hydro-MN, which is a combination of M and N peptide. Sorry about that. And these are minor antioxidants, lutein, which is commonly prescribed for the eyes, grape skin extract, which comes in resveratrol also for better circulation, and coenzyme Q10 that supposedly helps the cardiac muscle and even the skeletal muscles of your body, of your arms and legs. So those are the ingredients of this product. The product, the bio-DNA, comes or extracted from fish caught in the deep seas of France and certified to be free of contaminants. Supposedly, it is of highest standard. There's not contaminated with all those toxic metals. It's extracted by cold process. A cold process, that's an exclusive technology of the company that prepares it, that makes it, to ensure that it is biologically active. It bypasses the stomach because it doesn't really bypass. It passes through that, but it is protected from the acid of the stomach because it is enteric coated. So doctors know that there are pills that are enteric coated because they don't want them to be broken down by the acid in the stomach, and we want this medicine to be absorbed in the intestine. So when they are absorbed in the intestines, you absorb the active ingredients almost 100%, probably. I would say probably. And it prevents the destruction of the active peptides. See, active peptides, meaning peptides, you have to protect them because these peptides are related to protein. Again, it's a repetition of what I said earlier. What is the composition or ingredients of the capsule? Or no, this is not a capsule. It is a soft gel. And there's some. This was added by the company that sells. This is sold by a company in Singapore called Avita, and they were able to ask someone, a scientist in China, to do this. Taking high dose of Celergen can strengthen the ability of macrophages and NK cells, and it enhances the immunity. So how did they come to that conclusion? Because they did this in mice, and the Celergen can reduce the blood lactate in the eyes of mice and prove that Celergen has the function of relieving physical fatigue. So unfortunately, I cannot translate to you this. Shuling can do that later. So these are all powerful ingredients, again, just to emphasize, and how it is extracted from the fish. The milk, it's a wild salmon or herring. And the product extracted is water soluble. Well, the bio-DNA is touted to be an antioxidant against radiation, and there's some proof to that. Radiation meaning ionizing radiation like X-ray. It is shown to have help or treat asthenia. Asthenia is like a term used to say chronic weakness. Maybe nowadays when asthenia may be similar to chronic fatigue syndrome. It also had relieved some discomfort from the joint pains and arthrosis. And personally, on my plastic surgery patient, I have seen better wound healing in patients who take this 1 week before surgery and continue on for 1 month after surgery. And immune system, the only thing I can say about improving the immune system for persons taking Celergen, the first thing that they will share with you is I they will say I have not experienced getting my morning sneezing, my colds, my flu for several months, for 1 year already. And personally, that's also my experience. Aside from being armed with a lot of vitamin C. So this is a good antioxidant. This is a good supplement for anti-aging. People taking this have shown that they will notice by friends to be looking younger, better looking skin, more glowing, more radiance. But I don't tell my patients you don't need my services for surgery because I still need to do that. You continue to age, but the product, this supplement, delays your aging a little bit, maybe. Or else I will lose my job. What else? Some people who had taken this, they, depending on their age, boost their sex drive and potency and enhance heart function. I know of only one person who truly had enhanced heart function after taking a lot of a higher dose of Celergen. Again, this is one of the ingredients, the peptide E collagen, and this one is very good for the skin collagen, and the collagen in this peptide is almost similar to the same ratio as in the dermis of our skin. This is how it's being extracted by enzymatic hydrolysis. Also entirely water soluble, absorbed and from the intestine. It improves hydration and elasticity of the skin. And evidently, there are some who really swear by the reduction in the lines and wrinkles of the face. And I would say that because of that evidence, because of that sharing by different persons, I would say that this action of any of the ingredients of collagen is like rebuilding our body inside out. Then you have the combination of peptide MN in the Celergen. The peptide M has a proven action in the treatment of photoaging. This is the one that I think is the one that protects my skin from UV radiation, especially when I play a lot outdoors, and I don't even use sunblock. So it prevents the skin from premature aging. It lessens or minimizes the wrinkles, even the roughness. So the skin looks or feels even smoother. The laxity of the skin improves.
Sorry.
Some of the pigments are helped as well. It becomes lighter in color. It also has some effect on the osteoarthritis and even osteoporosis in some patients. One patient even had shown that the bone density had improved after several months or even a year or two of consumption of Celergen. And probably it's similar effect if you take the other supplements that contain chondroitin sulfate, glucosamine, and collagen supplement. peptide is the one touted to reduce the glycemic index. They always say reduction of the glycemic index. No, I think it improves the utilization of the sugar or glucose after you eat. So it's not the glycemic index of the food that you eat, but your body is being helped to improve the metabolism of the sugar that you took. And then because of that, we always were saying that it helps the body from accumulating fats, or so you don't gain weight. No. One question in the book that I showed you was what makes you fat? One of the books there said, eat fat and get, because they believe that fat will not make you fat. It is insulin that makes you fat. So why did they say that? Because if you have excess sugar or glucose in your food intake, the excess that is not, your body was not able to handle because it's in excess, it gets deposited, converted and deposited as fat. And what deposits it as fat is your excess insulin that was produced by your pancreas and was able to handle the normal amount of glucose that your body needs. And the excess has to be deposited as in storage for future use. So I hope that I made that clear about glycemic index and how your body gains weight when you eat more glucose, or any food that produces glucose becomes fat. Again, some studies had been done in relation to this, and this was all done in France, in Pessac, France, just to assure the consumers of this product. It carries with it worldwide certification, because we want to say that we need a certification that it is a prime quality and it's safe. So that's an assurance. Aside from that, this golden stamp is for elite athletes and professionals, because certified drug-free gamma, Celergen has passed over 168 types of the analysis of the protein assimilation agent, stimulants, diuretics, masking agents, anesthetics, marijuana, beta-2 agonists, beta receptor blockers, glucocorticoids, hormones, and metabolic regulation. So it will pass the test for prohibited drugs or prohibited supplements for professional athletes. And there's a question that is being posed to everybody, that can we take Celergen continuously? My answer there is yes. I had been on this supplement since 2015, when I was first introduced to it. And is it addictive? No, because it's not a drug. But then, mind you, just like people with sweet tooth, carbohydrate, sugar is addictive, more addictive than drugs. But I assure you, this is not addictive. If I run out of supply, I only tell Ligaya I miss it. You will miss it if you run out of supply. I will leave the question and answer for Shuling to answer, and some of them maybe I can answer if you need clarification. Thank you very much.
Hey, thank you, Dr. Lucero, for your insightful sharing. We have a better understanding of how to actually to support our immune system. So because this is the best line of defense. Okay. Now we open to everyone to ask any of the Q&A that you may have, and then myself and Dr. Lucero will do our best to answer your questions. Yeah. Anyone? Doc, you want to stop share screen first? Then we can see yourself. Yes. Yeah. Okay, there's one question. Can pregnant women take Selagen?
You're asking me?
Yeah. As a doctor?
We advise pregnant women to stop taking it once they know that they are pregnant already. What's the reason? No specific reason. We just want any whatever side effect it might have on the baby, on the pregnancy. Just like any drug that is prescribed to women, they are advised to stop the medication once they get pregnant. Most of them.
Yes, yeah. Because pregnant women go through different hormones changes. We just want to be on the safe side, although Selagen is a food supplement. There's also another question, Doc. Is Selagen good for all types of diabetics?
I will say yes.
Hmm.
I will say yes, good for any, but then let me put a little emphasis on this. Do not rely on Selagen to control your diabetes. Okay? In this way that many patients, many diabetic patients, their reply to me is, anyway, there's medicine available. I am taking medicine for my blood sugar, so I can eat anything that I like. So what is important in diabetics is to control your diet, not reduce the diet, not reduce the amount, but eat the right kind of food. Eat the right kind of food, which means that you have to drastically reduce the amount of your sugar and carbohydrates.
Yes, yeah. Diet play an important part. We cannot treat Selagen as a miracle.
No.
You know, yeah. Lifestyle is very important, especially diet. This will help to complement. So exercise, have a proper diet, nutrition is important, and Selagen will help to support that. There's one question that one of the participants asked. I have done my stand on one vessel in February. Is it advisable to take it?
Persons who have stent, most likely they have a blood thinner, right? Most likely they are on blood thinner for at least 1 or 2 years. So you have to carefully tell them that they have to monitor their blood coagulation, which they do if they are on blood thinner. And I guess that will eventually help them if they take Selagen, but try not to take too much because it really affects the blood coagulation or clotting. It can prolong it. So that's the only precaution.
Yeah. So generally our advice is to have a gap, okay, minimum 2 to 4 hours between taking the blood thinner and Selagen. That will be safe. Huh? Okay.
Not really, because the effect of the blood thinner is there. It is for 24 hours or even longer. I can't remember what is the half-life of that. So you rely on just the gap or interval. You cannot rely on that.
All right. So have to closely monitor. Okay, there's another question. Can Selagen help people with low heartbeat rates?
Low heartbeat. That's very good. If you have a low heartbeat, you're an athlete.
Yeah, athlete usually have no heart.
No. But those we call them bradycardia, they're too low, so they cannot function very well. They're too weak because the heart is not pumping enough blood. It's too slow. So they have to have themselves examined
Mm.
for that problem. If there is organically something wrong with their heart, they have to be treated.
Mm. Okay. That's another question. Can surgery help with COVID patient?
Not when you are already affected by COVID and uh, you did not embrace a healthy lifestyle before, and so you are an example of someone in a high risk category because you probably have a chronic illness. That's why you got the COVID. But that's not safe to say that only those with chronic illnesses are of high risk, because we also see some healthy looking individuals who were affected by COVID. Will it help them? Probably yes, probably no. How will you give it? Maybe if they have only the symptoms, they are not severely ill, they can start taking one or two soft gels
Mm.
to help their immune system as well.
Mm. Yes, yeah. Prevention is better than cure. So it's always good to support our immune system so that we won't be attacked with this deadly virus. Yeah? There's another question that asks whether surgeon will increase the estrogen level of women, and if they have breast cancer with estrogen level increases, can they take surgeon?
I don't know. I have no answer to that.
Mm, mm,
The only way to find out is if they are taking Celergen, to measure if they took the level of their estrogen before taking Celergen, and measure it after some time of maybe after a month or two of taking Celergen, maybe measure the estrogen again.
mm.
I have no good answer there.
Right. Okay. Check with the doctor. And yeah. We know Celergen is superior than fish oil. Can you explain more about this, as fish oil has different component?
That's not, the two are not comparable. They're not the same.
Mm.
Fish oil is fish oil. It's only the oil that is extracted from the fish. It's like you eat a lot of salmon. You eat a lot of fatty, oily fish. So you're eating a lot of fish oil. But I really don't know what part of the fish they get the bio DNA. I don't have information on that. But the two are not the same. Fish oil is fish oil only.
Mm. Yeah,
The bio DNA is not fish oil. But mind you, when you open the soft gel of Celergen, you get it out of the blister packaging. It smells like fish oil, right? It smells like fish oil, but it's not the same. It smells fishy. That's not a good word to say. It smells fishy.
because it's still the ingredients are still intact, yeah, because of the cold press technology. That's why.
Yeah.
Mm. Yeah.
Well, in fact, if you break the soft gel coating, the shell, it's a little thick liquid coming out of that. You know that because some patients who cannot take it orally, they cannot swallow, and let's say they are being fed through a stomach tube, then they break it and then they just keep it there. So I know of someone who had given a broken Celergen soft gel to their pets.
Yes, in fact, yeah, to the dogs and even cats. and help them in their bones issue and some of
Yeah,
the
it
skin
does. It
condition.
does. Yeah. I've seen that. I've seen that myself. It does.
Yeah. There's a question. Can women both take Selagen and these hormones, Progonova? I think it's a hormone medication.
Oh yeah, why not? They can take that, but then they have to be careful. What's the hormone for? What is the hormone for? What is the um, just like related to the previous question? That will it increase the estrogen level when they take the Selagen? So those are things that you have to take in consideration to the other conditions of the body or the person.
Yeah, we have to monitor and closely observe.
Yes.
There's another question also. When you're taking aspirin as a blood thinner, can you take Selagen?
Yes.
Yeah, just now doctor also answered that.
Yeah.
So you just have to monitor closely. Yeah. And there's a question on kidney function. My kidney function is 50% now. Is it safe to take Selagen on a regular basis?
Normally, as a rule, I advise them not to take it if their creatinine is going up and up, meaning that the kidney is being compromised. And especially if they are close to that stage when they will need dialysis. I don't prescribe it. I don't recommend it to patients like that.
Yeah. What we advocate is prevention is better than cure. Okay, so don't wait till we have chronic diseases, then we try to take Selagen to treat all these chronic condition. Prevent ourselves from getting into this state. That would be the most ideal, right? That's our.
But maybe if their creatinine, they know that their creatinine is a little higher than the normal. Maybe they can try it and then observe if the Selagen is affecting the level of their creatinine, even if they are very careful with their diet or protein intake, maybe they should stop.
What we recommend is we complement it with meridian therapy, traditional Chinese medicine. Yeah, it's a form of meridian therapy that you can do acupressure massage with Abita herbal essential oil to improve the kidney functions. Yeah, so do this and then monitor and see, because there's a meridian therapy is a natural self-healing that is inbuilt in our body that can help to relieve some of this condition. Okay, but we still emphasize prevention is better than cure. So take care of yourself so that we won't end up into all these chronic conditions. Okay, some questions on skin allergy and eczema. This one I can answer because we do see many customers with very chronic skin allergy or eczema condition recovered by taking Selagen, because also sometimes eczema is also a form of autoimmune system issue, because so once Selagen help to repair the cells, it help to heal and then regenerate. Some of these conditions can be improved. Yeah? But of course, eczema itself is very complicated. We also have to see where are the rashes, where are the eczema, based on the meridian system. Okay, then we can also advise you how can you further improve your organs by doing the meridian therapy. So both can complement very well. Yeah. For those who have gastric problem, not to worry. How do you take Selagen? Okay, maybe in this case you don't take on an empty stomach, because generally we advise to take on empty stomach first thing in the morning when you wake up, and then within 30 minutes you take the supplement. Okay, for those with gastric condition, you can actually take it after breakfast. Okay, when your condition improves, when your gastric problem goes away, then you can try taking on an empty stomach, because that's the best effect. Yeah. Okay. How can Selagen help to strengthen leaky valve?
The what?
Leaky valve. I think is it the heart?
The valve?
Yeah, the valve. Yeah.
Yes, it's the heart. There's a vein that connected to the heart. I don't know. I think it's called aorta or something like that. And then
No. That's the valves inside the heart. Those are the valves inside the heart. Will it improve? Oh, I really don't know because sometimes anatomically wrong, something wrong with the valve, and some of them need to be surgically treated,
Exactly.
replaced.
Mm.
Yeah.
Because my mom has
So
this
no,
problem.
I don't think I would say yes to that. Pardon?
My mom is 85 and she has this problem, leaky valve. And the doctor did ask her to go for a surgery, but because of her age,
Leaky valve.
yes,
Leaky valve.
yes,
Ah,
the
that's
blood
what.
flow backwards instead of
Yes, yes.
forwards.
That's, we call them regurgitation. So leaky valve. The blood goes back into the
Yes.
chamber. So depends on how much is the leak, or
Mm,
depends, and then depends also probably. I'm not a heart surgeon, but
mm,
probably it depends on what's wrong with the valve. Because
mm-hmm.
of age, over the years, the valve becomes stiff from, let's say, cholesterol plaque deposits or what.
Correct.
Why That's why it becomes weak, and it cannot function very well. So those are things that only the heart doctor and heart surgeon can determine and what can be improved. I don't think we can uh, we can say that supplements alone will help that.
Mm-hmm.
No, I don't think so.
Okay. Thank you, doctor.
But then, may I add that all of these things that you're asking about, let's say blockage, leakage, deposits of cholesterol. That's why I emphasize their cholesterol in my slide with the chronic illness. I don't believe in lowering cholesterol anymore. I have not taken my medication for cholesterol for more than 2 years.
Mm.
I don't mind my level of cholesterol
Yes, yeah.
because there are other reasons why cholesterol gets deposited. Again, we will go back to dieting. What kind of food you should not eat together with this and this and that. It's a long story.
Yes, yeah. We do have a friend who has some heart condition also to do with the valve. He's supposed to schedule for surgery, but after taking surgery, he's able to, do not need the surgery. Of course, it depends on individual.
I met
Really,
that person.
yeah,
I
I don't
know that
know.
person.
Yes, yeah.
That's the one I was referring to
Hmm,
about the improvement of the heart.
hmm,
You know,
yeah. So because Saligen is only a food supplement, so you can consider, okay, to try this for your mom. Okay, there's also a question: can Saligen, after 6 months of heart surgery, bypass take Saligen?
after heart surgery.
Mm-hmm.
Oh
Bypass,
yes.
yeah,
After a bypass, and then you have to again look at the blood thinner that they are taking, if they are on it.
yeah. Okay.
Maybe yes, you have to monitor that also. And there's nothing wrong with. As I said, I give this Celogen to patients a week before their surgery, but
Mm-hmm.
this is for plastic surgery, for
Yeah.
cosmetic surgery, and they experience a better healing, better recovery, less bruising.
Mm.
And so these are patients who had previous surgery from somewhere or from me, and they say, why is it my second time or third time I have a better experience? And they're even older, you know,
Mm.
why? They
Yeah.
were on Celergen for at least 1 week before surgery.
Yeah, we have them in the recovery and surgery. We have a friend Ray. You want to ask question? Yes, let me spotlight you. Just hang on, and unmute you.
Ray,
Hello,
Yes,
hi.
yeah.
Hi, good
Ray.
morning.
Uh-huh.
Yeah, I'm more particular on the Celergen really is very important in immune system, especially now with COVID-19.
Uh-huh.
Now, I feel that it can really produce immunity through reducing the leaky gut syndrome.
Uh-huh.
So we know that 80% of our immune system is in the gut.
Uh-huh.
We repair our gut, the immune system will go back, and
Uh-huh.
it can really reduce the effect of the COVID-19. Yeah, I think that's how I feel it.
Yes.
Well, that's a corollary to Ray, corollary to the immune system that I did not mention in my talk, because it's going to get longer if I talk about the microbiome. The
Yeah.
microbiome is the good bacteria, the good bacteria inside your intestine that you have to maintain. And that's what Ray is saying. If you, probably the Celergen plays a role in maintaining the healthy microbiome in our gut, in our intestine. And Avita also has a probiotic product for that purpose. In addition to that, Ray, may I add that it is also important to maintain the health of our microbiome or our gut defense system by good diet. Again, it goes back to diet, Ray.
Yeah, yeah. No, my point is really to prevent leaky gut. No, meaning
Yes.
there will be no more leak in the gut. No, it's not really the microbiome, but
Yeah.
the leak on the gut. No, because it repairs the gut.
Yes.
Pero, you know, Ray, many of our fellow, our colleagues in the gastroenterology field do not believe in leaky gut. Very, very few of them believe there's a leaky gut syndrome.
Yeah. Complement with Avita, we have a very good probiotic called the Live Biotic, okay, plus, because it has a special K21 bacterial strand that can help to improve the gut condition. So we know the gut is also our second brain, both are connected. So
Yeah.
it plays a very important role as well. So we can complement Celergen with Live Biotic as well. Okay. Yeah, thank you. Just the last question we answer. Yeah, so just now we have one, can Celergen help with irritable bowel syndrome? Yes, together with our Live Biotic, you can complement together. Okay. For fatigue syndrome, yes, because this one, because a lot of time chronic fatigue, you know, insufficient rest or that, many of our customers and our associates experience, you know, increase in energy level, so they don't feel so tired. Okay, and also if it's okay, there's one question. If a person has a genetic diabetic and cholesterol since he was born, will Celergen be able to help?
Congenital what?
If this person is have a genetic diabetic and cholesterol since born, since birth,
No.
Will it help?
So
yeah,
the genetic.
Nothing.
yeah, no harm trying, right? Because whether
harm. We don't want to do any harm to take Celergen, even if it's a genetic problem.
yeah, okay,
I remember one young mother who gave cut the Celergen into what, half or three parts, and then gave it to the autistic child. I'm not so sure if that's autistic, but he said it helped. You know.
yes, yeah, okay. Thank you so much. I think we have answered most of the questions. Okay, maybe just last one question because time is running up as well, yeah? Okay, can one stop taking osteoporosis pill and just take Celergen instead?
What will she stop?
Taking osteoporosis pill for bone conditions.
Oh, say yes. Depending on what is that medication taking for the osteoporosis. Not right away. Don't stop it right away.
Yes.
You know?
Yeah.
Don't stop it right away and wait for the bone density to come back. If there's no, see, the only way to tell is with the medicine that she's taking for osteoporosis, is there any change in the bone density over time, after taking it, let's say, for a year, and then she started on Celergen, and several months after starting on Celergen, the bone density improved, then by herself, she probably can say, this is effective for my bone. Then she can slowly take away or stop or reduce or stop the medicine for osteoporosis. I would handle it that way.
Yeah, usually we recommend do not cut any medication on your own record. Okay, so please consult your doctor. Your doctor, when he see your indexes and the condition improve, then doctor will also help to tell you to cut down the medication. This is what we see in many
The same applies for diabetic patients.
Yes, yeah.
They start to believe that Celergen can help lower their blood sugar regardless of what they're eating. Then they stop their medication. They're going to get into trouble.
Yeah, yeah. So at the end of the day, diet still play an important role. Don't think that Celergen is a miracle pill. You can treat everything. Okay, so proper nutrition, diet, okay, exercise, all that play an important role. Okay.
True.
Yeah. Okay, I think we have answered most of the questions. Okay, thank you so much, Dr. Lucero, for your time. Dr. Lucero is also one of our Diamond president leaders, Avita, okay, pioneering the Philippine markets. And this Zoom forum is actually organized by CPE Philippines, and the CEO is none other than the wife of Dr. Lucero. Okay, so now we would like to invite Dr. Lucero's wife, Tinette, also the CPE CEO, and then she is the one who initiated this forum. Yeah, shall we invite Tinette? Yes, over to you, Tinette. Yes, let's spotlight. Hello. Okay, unmute. Yes.
No, she's muted.
Oh, okay.
She's muted.
Okay, let me try unmute again. Okay, yeah, okay now.
No.
Hey? No.
Mute.
Okay.
Hello?
Unmute. Yes, we can hear you now, Tinette.
Okay, hi. Good. Hello, thank you everyone for joining us in this Zoom meeting. Thank you, my husband, Dr. Lucero, for a very informative talk. Of course, we are committed to continue to help all our clients. We believe in awareness is for more preparedness. And of course, they ask me in this time of COVID, all the more have to, as much as there are a lot of health protocols which we are asked to do, like it's not rocket science to wear our mask every day, all the time, aside from the avoiding crowd and doing social distancing. But of course, because we are aging, we want surer protection. That's why we encourage people to double up with their vitamin C's and with their cellular health, particularly Celergen. So we continue to be of service to our clients, to our patients, and to our new clients too for this COVID-19. And we hope everyone, all of us, survive this pandemic, come out alive, and continue to do our work. And even it may be a very, very challenging, things are hard, doing work's hard, inconvenient with all our protective gear. But I think, well, the more we understand the body, the more we understand how the virus can harm our body, we will believe that more than ever we should love our life because we only have one and invest on our body, primarily by taking the best supplement available. Thank you again, everyone. And too late. Thank you so much. Thank you, my husband.
Thank you, Tinette, yes, for organizing this forum so that everybody can benefit. Yes, we have only one life. Life is precious. Please take good care of it. Okay. So, and also, of course, concurrent with this special forum, we have a special promotion for our friends who have not experienced Celergen. Okay, there's a promotion. Okay, let me just share the slide. Okay, if you have not experienced Celergen yet, okay, you can join us as a member. Okay, get a twin pack. The original price is 946 Sing dollar, and then now you can get it only at 578 Sing dollar, or in the relevant currency in the country that you are residing. Okay, and of course, for those who want a bigger package, you think that you can help your family as well. Okay, you can take the 6-box special package based on the currency that's shown in front of the screen. Okay, so you can take a picture of this promotion and get in touch of the introducer who introduced you to this talk, and then they will teach you and then help you to order this allergen and get started. And that's protect ourselves, support our immune system so that we can stay ourselves away from this invisible enemy. Okay, thank you for all your time, and I wish everybody good health and have a good weekend, and then stay in touch again. Okay, thank you very much for your time. Okay, that's the end of our talk. Thank you, Dr. Lucero. Thank you, Tinette, and also the team behind organizing this. Okay, thank you very much, everybody. Goodbye.
Thank you, Doc.
Okay, thank you, everyone.
Thank you, Doc Lucero. Thank you, Mom.
Thank you.
Yes, yeah, thank you, everyone.
Yeah.
Stay safe, everyone. Thank you, Doc.
Thank you.
Learned a lot today. Yes.
See you again.
See you.
Thank you.
Bye.
Doc, we just stay back. Yeah. The organizing team. Yeah, we stay back for a while.
Oh, me?
Yeah.
Okay.
Higaya, Abby, yourself.